Hey guys, I'm Dr. Preeti and I'm a mother to a Red Warrior. Today we're going to be discussing about the unusual child. Why is my child behaving weird? Why is my child doing unusual things? So when my daughter was diagnosed with sensory processing disorder, I remember frantically searching on Google to find out what could be the cause. I mean, I just knew she had the symptoms. She was head banging, she was teeth grinding, she was doing such weird stuff. Just didn't make sense to me. And the stuff that I Googled was, why is my daughter weird? Why is she doing this weird stuff or unusual things? And nothing came up. It was only after a therapist diagnosed and specifically mentioned that she has sensory issues was I able to figure out that she has sensory processing disorder. So today we're going to speak about what is normal sensory processing, and then we'll be able to understand what is sensory processing disorder. That is when things don't function the way they're supposed to function. What is normal sensory processing? Now, sensory processing refers to how people are able to use all the information provided to their body or to their brain. Okay, all the information that is available from different sensations which is coming from inside the body as well as outside, that's from the environment. Now, all the senses work together and they integrate and they form an understanding in the brain. Okay, they form an understanding of what you are, where you are, and what is happening around you. Let me simplify it. Now, see, we experience sensations all the time, right? We have sensations from within our body, like hunger or the feeling that you want to urinate or pass stools. All these are sensations, and you also have sensations outside your body, like what you can feel. You can, when you touch something, you feel something. You can see, you can hear. So there are various sensations which are coming all the time. All these sensory inputs are always, you know, all the time you are receiving sensory input. The brain is receiving all the sensory input. Now, when we were kids, we used to learn that there are five senses, but actually there are eight senses. So I will deal about the eight senses a little later. But what you need to understand is that you have something called sensory receptors all over your body, and these receptors get stimulated. The work of the sensory receptor is to just pick up the sense. For example, say you are smelling a perfume. The work of the sensory receptor, which is present in your nose, is to pick up smell. It's not going to give you information on what kind of smell it is. All this, once the receptor has picked up this information, this information is going to travel to your brain. Through some nervous pathways, nervous channels, it goes and travels to your brain. The brain is important for processing this information. The brain gives meaning, it maps meaning to what smell it is. Okay, and this happens because of previous experiences. So say if you're previously smelled the same perfume, your brain is able to process the information and tell you what exact perfume you've smelled. So the receptors in your nose, the work of the receptor is only to pick up smell. The work of the brain is to process the information and make sense of it or give meaning to it. All right. Once the output is in the form of a response. This response is generally generated in terms of a behavior or in terms of a motor response. So, say you're smelling something which is really nice, like a perfume, you will probably sniff again to smell again. Right. Now, one more thing we need to understand that is all our senses are acting all the time and they're all coordinating with one another and acting together as a single unit. When multisensory integration is not adequately processed by the brain, then it leads to sensory processing disorder. So, what's happening in sensory processing disorder is you have the sensory input. By means of that, it's your smell or what you see, what you touch, what you taste, all the sensory input, what is received from external to our body and within our body is going to the brain. But where is the defect? One is some problem with the pathway. That is, whatever sense, once the sense is picking up, that information is not traveling to the brain. That the brain is having trouble receiving this information, or the brain has trouble understanding and processing and making sense of this information. So if you're smelling and the brain doesn't know, doesn't is not able to make sense of what that smell is, the output is obviously going to be inappropriate. So what is happening is like a mini traffic jam that is happening within the brain. So you have all the input, but the output is not right because there's a traffic jam in the brain, and the brain does not know how to send the right output. All right. Now, this is in short, it's called as SPD, sensory processing disorder. It is not recognized as a standalone diagnosis. Um, it is not a part of the DSM criteria. So, if you closely observe, most of the children with autism who are on the autism spectrum, children with Rett's, Downs, Angelman's, and a lot of other genetic syndromes, majority of them have sensory issues and have sensory processing. So, one, it's not a standalone diagnosis, but it is a part of other syndromes. But it is equally important because only after you train your body to integrate the senses will the brain be able to make sense of whatever information that's coming and give you the right output. The next question is, what are the causes of sensory processing disorder? Now, just like any other neurodevelopmental or neurodevelopmental disorders, the exact cause is not yet identified. But research says that it is inherited. There are prenatal complications, there are pregnancy complications, birth complications, environmental factors, all of which play a role. Can we prevent SPD? No, you cannot prevent something which is already formed in a child. There's a small genetic component also. So when the child is formed in the womb, that is when the child has an SPD. You cannot prevent it. Can we cure it? There is no definitive cure. It's a chronic lifelong disorder. So once a child has SPD, lifelong the child has SPD. But there are various therapies, various treatments which are available, which can help the child to learn to cope up with these sensory issues. There is no medical treatment. You do not give medications for these children. What we do is something called sensory integration, so that we teach the child to use multiple senses simultaneously, and we're kind of giving different exercises to the brain so that the brain, over repetition, learns to actually make sense of whatever senses, whatever information the senses are sending to the brain. Certain points about sensory processing disorder is that individuals with SPD, they can have one of their senses or they can have multiple of their senses affected together simultaneously. Most of them, it is actually multiple senses which are simultaneously affected. They are unable to perform everyday tasks. Let's say a simple task such as walking. Walking requires coordination of your all your senses. You need to move your hand, you need to move your leg, you need to see where you're walking, you need to see the ground, you need to be able to see if you're climbing a step or getting down a step. There are a lot of things which are involved, and you need to be able to feel the ground, to feel if the ground is hard or soft, how much pressure you should put, right? So there are multiple senses which are functioning together for a simple activity such as walking. So everyday tasks like walking, sitting, climbing, crawling, to eating, to putting on your dress, everything, or reading, writing, all of these activities are affected. They, like autism, SPD has a huge spectrum. You have children who are mild, you have children who are severe. And also, there is a different set or different combination of senses affected in different children. So you can have a child which has one or two senses affected. You can have another child where all the eight senses are affected. It varies, and each of the senses could be affected to different variations. So each child is unique, just like how in autism we say each child is unique, have their own set of characteristics. Similarly, SPD, each child is unique. We need to assess each child, assess what kind of sensory challenges that child has, and then proceed for further therapy. Okay, it can be managed by treatment by an occupational therapist who does sensory integration, a sensory diet which is done by parents at home, and exercises. All right. Children cannot outgrow SPD. I mentioned this already, but they learn strategies to cope up with these sensory disorders. And if it is not treated, it is going to persist until adulthood. And what can happen is the child will have anxiety, depression, a feeling of not worthy, and the child will also have difficulty with daily activities, difficulty in social skills, marriage, work, school, name it, everything. Child is going to have struggle throughout, and without knowing the cause of why it's struggling so much. Mhm. Okay, one more thing to notice, SPD and autism are different. SPD and autism are two standalone diagnoses. Majority of the children with autism have SPD, but children with SPD doesn't mean that all of them have autism, right? You can have children who just have SPD without autism as well. So both are standalone diagnoses. Um, Remember that working on it doesn't matter if your child is diagnosed to have sensory issues, start off therapies. You don't need to wait till official autism diagnosis to start on therapies. As mentioned previously, there are a total of 8 sensory systems: visual, auditory, tactile, smell, taste. These are the 5 we would have learned in school, right? There are 3 other senses which are equally important: vestibular, proprioceptive, and interoceptive. Since I want to keep these videos short, say about 10 to 15 minutes, I'm going to end this video right here. We are going to deal with each of these senses in separate videos. The next series of videos, I am going to talk about each of the senses, how they actually work in a normal individual, and why it is not working in a child with sensory processing disorder. And then I will be speaking about how to identify if the child has signs and symptoms of dysfunction of that particular sensory system. And hopefully, if I can cover in 10 minutes, I will try to incorporate what are the activities that can be done based on the signs and symptoms. All right. Thank you so much for listening. I hope you look forward for the remaining videos on sensory systems and the signs and symptoms of diagnosing your child with SPD. Thank you.